As yoga teachers, we're often asked, what kind of yoga is best for low back pain? And the answer is that it always depends. It depends on what's causing the low back pain. Low back pain can be muscular, structural, it can be caused by our posture. One of the things that we can do to help our students self-assess and figure out what's causing their low back pain is to ask them questions they can ask themselves. When do you experience the low back pain? Is it when you're doing something in particular or specific with your body? Standing, sitting, forward folding, back bending, twisting? Is it consistent and constant? Do you feel it all the time? Or does it come in random waves? Is there anything you do that makes it better? Or is there anything you do that always makes it worse? And if the student is not able to figure out the cause of the low back pain, then maybe they need to go see their healthcare provider. And the healthcare provider has the equipment and expertise to either identify or exclude that it's a structural issue, and they can usually get to the bottom of it pretty quickly. And then our students come back to us, and they have the information we need to be able to design a yoga practice for them. In our 200-hour yoga teacher training, Alicia talks about adaptive shortening and the anatomy module. And sometimes what happens, because we all sit a lot right now, and sitting is one thing, but we have to counter that with movement. We have to stand, we have to move, and we have to open the front body, because when we're sitting, we're really compressing the front body. And so a lot of times we sit and we don't counter properly. And when we do that, we can have adaptive shortening through the front body. And what happens is that our hip flexors become tight and shortened, and our abdominal muscles shorten and become tight because we're sitting in this position. So that can cause a muscular imbalance throughout the body, and that muscular imbalance can lead to low back pain. So one of the things you can do is just get a bolster, and every day, a couple times a day, spend 5 or 10 minutes in a supported back bend with the bolster. And that really lengthens the front body, it'll lengthen the abdominal muscles. You could even take a reclined hero's pose, or maybe have heroes, and to kind of lengthen the hip flexor area a little bit. We can also get structural issues that result from the prolonged sitting that we do in our society now. And what can happen is when we're sitting, we lose the natural curvature we have in the lumbar spine. And we need that curve in our low back. So when we lose that, what happens is the front of the spine can become compressed. And the discs between the vertebrae can experience dysfunction. You may get bulging discs, which can cause significant pain in the low back area. And structural issues like bulging discs, herniated discs, even degenerative disc disease can cause a lot of pain in the low back. And so there's structural issues, there's postural issues, and then there's muscular issues. Sometimes we have a part of the body that is tight and is not prepared to support us in the movement that we're going into. So for example, if we're going into a forward bend, whether it's a standing forward bend or a seated forward bend, 65 to 70% of the forward bend should take place from the movement in the hip joint. And the other 35 to 30% takes place in spinal movement, right? And what happens, like let's say you have really tight hamstrings, which I'm very familiar with because I do. When you're going into the forward bend, there's this place where as the pelvis shifts forward and down, you come to the head of the femurs, the heads of the femur bones. And when that happens, the hip joint is at its maximum range of motion. You can't go any further. But sometimes we want to go further. We don't have the awareness to realize that we've come to our edge in our forward bend. And so then we take it all in the spine. And when that happens, we can overstretch, overuse the spine. It's like we're overdoing it in the back body, and it can cause pain. So one of the things that we want to do is we get the stack of blankets or the block to sit on in a forward bend, which will bring the pelvis into more of an anterior tilt. And actually, depending on the starting point of the pelvis, that can bring the pelvis into a neutral place. And a neutral pelvis is, of course, a healthy pelvis, so that's what we want. And then you're going to feel more of the forward bend in your hamstrings and not so much in the spine. You're not going to overstretch. And there are things you can do with back bending also to make sure that you have healthy back bends that aren't going to contribute to low back pain. One of those things is you want to make sure that the hip flexors are open when you start the back bending process. Open hip flexors allow the pelvis to move freely so that you can back bend safely and effectively. So you want to open those hip flexors, and you also want to make sure that you're back bending evenly throughout the spine. You don't want the lumbar spine to take the whole back bend and become compressed, because that can cause a lot of pain in the low back area. And so this is a starting point for us as yoga teachers with low back pain and how we can help our students. I think one of the most important considerations is that we want to act in our scope of practice as yoga teachers. So we don't ever want to try to diagnose anybody. We don't want to try to figure out what's causing the low back pain. We want to leave that for our students to figure out with their healthcare professionals. And once they know what's causing their low back pain, that's when we come in and we're able to design an effective yoga practice, because yoga can sometimes help low back pain, sometimes it can cause low back pain, and sometimes it can make it worse. So whether or not a student should be practicing yoga when they have issues going on in the low back is not something that we as yoga teachers are qualified to determine. We let them find out what's going on, and then if it's safe for them to practice and we know what's going on with their low back, we can help find the best yoga poses for them.